Hi, my name is Dr. Vikas Kohli and I'm a child heart specialist. I'm here to discuss with you today about vaccinations, that is COVID vaccination, and its effect on the heart. So before we get started, I must clarify that we want to divide the vaccines into two major groups. One is the example being AstraZeneca, Covishield and Covaxin. The Covishield Covaxin being made in India, AstraZeneca is the same as Covishield and is manufactured outside. So these are traditional technology vaccines. And on the other hand, in the other limb are the Moderna and the Pfizer. These are the newer technology, the mRNA-based vaccines. So what is the major difference of these two vaccines and their effect on protection in adults? Let's start with that first, very briefly, so that we can talk about kids a little later. So in adults, Pfizer and Moderna vaccine may have almost 90% protection against the common variants of COVID, not the Delta variant necessarily, and that data might still be coming on, and I'm referring and talking to you towards the end of July. So Covishield and Covaxin, on the other hand, may have a 70 to 80% effect against the traditional COVID infection, which is the first wave or the normal strains of COVID. So this is the protection rate. Now talking about safety, as you all know, the adult safety is pretty good, minor side effects we all are aware of, but let's go on specifically to children. Now in children, vaccination is currently being done in the United States of America and is most likely going to start very soon in few European countries and United Kingdom. So in UK and in United States, where the vaccination has taken place, it's taken place with the vaccines they use predominantly in their own country. That is, in US, it is Pfizer and Moderna. So do children with heart disease, are they likely to get and should they get the vaccination? Well, yes, just like every other child, they should be getting the vaccine too. Is the vaccine safe in these children? So first of all, let's talk about the results in regular children. So vaccination, when tested in children above 12 years of age, the trials showed that the antibody levels are generated very well in children, better in children than adults. Their immune system is more responsive and hyper responsive. And not only that, the side effects may be much less in children. All these trials were done in children above 12 years of age and were done with Pfizer and Moderna mainly. And so we know that these two vaccines are safe to use in children, have produced a good antibody response. In addition, we also know that the children do well with this, and just like adults, they would get. So protection, enough protection. So it's safe to get vaccination children above 12 years, except for one caveat, which we will come to in a little later. So what about under 12 years? The trials are on for children between 2 and 12 years of age, and those trial results would come out soon, and then those children would also get the vaccination subsequently. Now, going back to what is the problem with Pfizer, Moderna, the mRNA technology-based vaccine when it comes to children per se, not necessarily children with heart disease. A very, very, very small and rare side effect seen in 1 in a million child is that their heart muscle becomes weak, the Pfizer vaccine, specifically in the Moderna one. And this is so minor that only in blood levels it can be tested and confirmed that the heart muscle has been affected, or it may be the membrane outside the heart which gets affected and swollen, and there is medical treatment for both, and medicines have a very good response. The effect is so minor, in fact, that most of the children, about 1,000 children in total till now, have had this done. In those children, we did not need to admit the children in the hospital. Also, majority of them recovered at home and did very well at home itself. So the Moderna Pfizer vaccine have a very, very rare and a very minor side effect on the heart. Covishield and Covaxin, which are our traditional vaccines, have not been noted to have any such side effect on the heart. So it seems that maybe the side effect is not related to the virus, but more related to the technology being used to make the vaccine, maybe, and I'm not sure of that, and we in science are not yet sure of this. So when the government says in India that we can give vaccination to children above 12 years, your child, even if he has heart surgery, or he has a weak heart muscle, or he has had these in the past, or he has had heart surgery in the past, any of these, he can take the Covishield or the Covaxin, whichever you would want him to take, and both are equally safe and are going to work equally well in children also. We look forward to the results of 2 years to 12 years trials, and towards the later half of the year, probably after October, those results would also be available, and the Western countries would start vaccinating those children, while we would probably start vaccinating once the vaccine is approved in our country by the Government of India for those children too. And that is the basic information, that vaccination per se is very safe. Everybody should get vaccinated and should have protection against COVID. The standard protection would still hold good. And a rare side effect, which is extremely minor and extremely subtle in children with Pfizer and Moderna vaccine, has been noted, but is not enough or significant enough for us to worry about. Thank you very much.